There's more than one way to change the shape of your chin, and most people don't realize how different the options actually are. Today, I will break down every type of genioplasty: bone-based surgery, chin implants, and non-surgical options like fillers. What is genioplasty? Genioplasty is a procedure designed to change the shape, position, and orientation of the chin. But not all genioplasty procedures work the same way. And if you choose the wrong one, you might get results that you're not happy with. So let's walk through what your options are. First, you have a sliding genioplasty. A sliding genioplasty is a surgical procedure that augments your chin and changes the position of your chin by using your own bone. Depending on where your chin is at baseline, genioplasty is a very versatile procedure to move your chin forward, up, down, back, and depending on your actual need, what we do is we create an osteotomy or a cut through the bone. We position the bone in its new position based on your ideal outcome, and then we use hardware, plates and screws, in order to hold the chin bone in place. Over the course of about 6 weeks, your body heals that bone back together. This option is best for recessed or weak chins, or vice versa, overly prominent chins that go out beyond the lip line themselves. It can also work for chin asymmetry and vertical height issues. Because genioplasty uses your own bone, the results of genioplasty are very precise, and once it's healed, that is your own bone moving forward. That is just your chin. This is usually the best option when you need structural correction, not just necessarily volume. The next option is a chin implant genioplasty. A chin implant is another surgical procedure that, rather than using your own bone, an implant is used to augment on top of your native bone in order to add volume and shape to your chin. Implants come in multiple different materials as well as shapes, and they're designed to improve projection front to back as well as mild asymmetry. And this option works well for people who want mild chin projection increases, mild augmentations, very small increases in vertical height. And implants are best for people who may not need full bone repositioning. Implants can create noticeable improvement, but they're not quite as customizable as what we can do with a sliding genioplasty. And they do not correct vertical or bite-related issues. Now let's talk about some non-surgical chin options. Non-surgical chin enhancement usually means dermal fillers. Fillers can temporarily improve volume, advancement, and provide support to the chin for the short term and without surgery. This option may be right for you if you want a subtle change, if you're not ready for surgery, or you just want to test out a chin shape. The downside is that fillers are temporary and they cannot correct any structural problems. So who is a good candidate for a genioplasty? Most candidates are generally in good overall health, are non-smokers, are fully grown skeletally, and are realistic about their outcomes. In some cases, genioplasty is done for functional reasons, like improving airway alignment or correcting the deficits from trauma. It's not always about appearance. What is genioplasty recovery like? First, recovery will always depend on the type of procedure that you get. After surgery, you can expect mild amount of swelling, your lip will feel tight, your chin will always look taller than it will in the long term. Occasionally, people will have small amounts of bruising, and that can work its way down to just above your chest. It's very common that people have up to 12 hours or so of just very mild bleeding from incisions that are done from inside of the mouth, or if it's done from the outside, is a little bit through the incision there. For most patients, the amount of discomfort is very minimal, and we expect maybe 12 to 24 hours of stronger pain medication and 3 to 5 days of needing regular use of anti-inflammatory as well as Tylenol. You may be on a soft or liquid diet for the first 24 to 36 hours, but as soon as you feel like eating regular food, you're cleared to go. Always discuss that with your provider, but I'm very liberal about letting people eat what they want to eat because they're probably going to do it anyway. General activity should be limited for maybe a few days. As I tell everybody, just listen to your body, and then really the main thing is avoiding contact to your face. Good general advice, but as a jiu-jitsu person, having to take 4 weeks to have any contact would be hard. What my general recommendation is, up until 2 weeks, no contact to the chin. From 2 weeks to 6 weeks, you can have very light contact to the chin. Is always discuss what are your activities with your provider so you can make a personalized plan. Most of the swelling from genioplasty is going to be gone by about the 2-week mark. The full results will take anywhere from several months up to even a year, but the majority of those are seen very, very early by about the 3-month mark. So here are some risks and complications to know about from genioplasty. Like any surgery, a genioplasty has risks. Common short-term effects are swelling, bleeding, and bruising. There are some more serious risks, but they're much less common. These can include infections, implant issues, or bone healing problems. Your surgeon will also review anesthesia-associated risks with you during your consultation. But if you choose an experienced surgeon, potential for risks and complications is very, very low, but also something you should always discuss with your provider so that you understand what is my risk for me. So what are the benefits of doing a genioplasty? When done correctly, a genioplasty can dramatically improve facial balance and how you appear in profile. It can also create better harmony between the chin, nose, and jaw. It can boost your confidence, and in many cases it can improve breathing and overall airway alignment and support. So how much does genioplasty cost? The cost will always depend on the type of procedure, and a sliding genioplasty generally will cost more than an implant because of the surgical complexity. Pricing will depend on your location, your surgeon's experience, also the type of anesthesia you may have is going to be a big impact on what is the overall cost of your procedure, as well as how complex your case is. Most genioplasty procedures are considered fully cosmetic and are unlikely to be covered by any insurance, unless there's a specific medical reason for doing the genioplasty.